This is a very exciting day. We had two patients that came in today from our stem router, and the stem router is a instrument that's used for chronic pain. Um, so I'm going to show you two videos today. One was done by my nurse, and actually the patient is her father. He is a longtime diabetic. He's had chronic pain, burning, tingling, numbing in his lower extremities. And when he first came in to see me, his examination literally was demonstrating such poor opportunities for me to do our Dellen uh, treatment decompressions for those are surgical procedures for decompressing the nerves in the diabetic neuropathic patients. And 87% of the time, we have a complete remission or huge reduction of pain in the lower extremity for diabetic neuropathy patients. Um, he was not a good candidate for those procedures. And so as time has gone on, we have this new uh, stimulator for nerves, which is not unlike the stimulator that your pain management doctors will put in your back. But this is not put in near your spine. It's down in the area where the lower extremity pain is below the knee in our area. So there were two placements, one in the two big nerves in the lower extremity, the common fibular nerve that's around the outside of your fibular neck, which is on the outside just below the knee in the calf. And the other's on the inside behind the ankle, the tibial nerve, where I'm sure you've heard of tarsal tunnel. These are the huge nerves innervating the entire plantar aspect of the foot and the top of the foot. And the outer nerve, the common fibular nerve, is a motor and sensory nerve. That's what's called a mixed nerve. And that means that it affects not only your sensorium, where you get burning, tingling, numbness, but it also weakens the strength, and you are stumbling. If you are diabetic, you may have a uncertain gait. You feel like you're going to fall. This is because this nerve is entrapped, and your motor signals to the muscles out in the lower leg are weakened, and therefore you can't lift your foot as normal. And just shades of that weakness can cause the uh, problem to be severe enough that you feel some instability, but you don't have a total drop foot. So you're going to find in this patient that it was really very uh, helpful for him to have the decompression procedures in the areas where we normally decompress. But however, the stimulator put down in the lower extremity, you'll see has completely resolved his chronic pain. And he also has more sensorium and sensation back. Anxious for you to see that video. The next one is another patient who had the decompressions of these nerves as you would normally see for the Dellen releases, but it failed. And it failed so badly that he ended up going to see actually Dr. Dellen in Baltimore. And like so many of nerve procedures, they don't always work. So he had more decompression, and you'll hear this from the patient in the interview, which failed. So he's already had the decompressions that I would normally do. Then he had more extensive work up closer to the spine, upper leg, popliteal area, which is behind the knee, and also in the piriformis area, up and around the pelvic area from Dr. Dellen in Baltimore. Unfortunately, this did not work. But you will hear in the video, we did the decompression over what we call a revision, and the revision of the nerve in the lower extremity at the outer calf, as I described earlier, and inner tarsal tunnel area behind the ankle. And we used the stem router, and you will see how elated both this patient and his wife are in this conversation today. Hope you enjoy these. Thank you. This is Robert Parker, Dr. Robert Parker from Parker Foot and Ankle and the Neuropathy Care Center of Houston. Thank you.
All right, we're here with Mr. Smith, and he had a stem router 5 days ago. So what symptoms were you having before you came in?
Both of my legs from around the ankles just throbbed like you would hit your thumb with a hammer. That's how each one of my bottom around the ankles felt. It would just throb, throb, throb.
Okay. And so what are you noticing now since you had the stem router put in?
Nothing.
And the decompression?
No pain.
Okay. Are you're having more feeling on the bottom of your foot when you touch?
Some.
Okay. Was it immediate after the surgery that like the next day? Is that when you noticed it?
It was gone when I woke up.
Okay.
I haven't had it. It was sore from the surgery where he cut it. Those were sore the first day.
Okay.
And that went away the next day.
So it's the throbbing and the pain that's gone and some of the numbness.
Some of the numbness is gone. I can't. It's hard for me to tell with just touching. But it seems to be much better.
What about when you're walking? Do you notice any difference?
I'm lifting my feet better.
Yeah. I mean, you're in a post-op shoe, so it's kind of hard to tell with the post-op
But
shoe.
when I walk, I had to hold my walker because I don't have any balance. But last night I was trying, and I was walking, and I put the walker out in front of me and just tried to hold it steady and walk. And I could do that. Usually I have to lean on the walker, but it's not as bad. I can use the walker like it should be used, better.
Okay.
Okay, we're here today with Michael, and Michael has a really interesting history. You can see the scar from previous decompression of the defibrillator nerve dorsal midfoot, and none in the superficial fib, deep fib, and lower leg. But he's had quite a history. He had really good surgeons back in 2001. Did the standard decompression procedures, did not help him. He had back issues, and Michael, sorry for not asking you first. Do you mind if I use these videos to teach other doctors or help other patients? Your story, I'm going to let you I'm just telling the medical history real quickly. But then he was sent by the doctor that did this to the doctor that trained all of us in these procedures in Baltimore. And he had further releases the popliteal area, it sounds like, and a common fib again. And he's had back issues. He had piriformis surgery by the doctor in Baltimore, but it was not successful. So I'm not sure how they both decided for me to do this surgery, allow me to do this. But we brought in our stem router, and you can see the monitor applications on the outside here. Very interesting. Okay, yeah. So this has been, we did this last Wednesday, and today is Monday of 9/13. And Michael, tell us just briefly then, you came in to see me because all these other procedures did not work. What symptoms were you actually having?
I've been having my right leg and foot just constantly burns.
Yeah.
24/7. And started out just like a sock, and then over the years it's just gone up my leg. So it's
What level of pain was that on the pain scale, say, out of 10?
On average, I usually run around a 6 to 7, and sometimes I've hit at least a 10.
And what medicines were you, when you saw me before our surgery last week, what medicines are you on, or were you on for that burning? And
just ibuprofen.
okay, just you didn't take gabapentin or Lyrica or those things?
We've tried all of those, and none of that worked.
None of it worked.
I have Cymbalta, which helps a little bit, and Suboxone.
Okay.
That helps take the edge off a little.
Okay. So we did our stem router implant, and I always do when I can, if a patient has a circulation and is able to stand it, I go and redo the standard release neurolysis of the common fibular nerve and all its branches, plus a fasciotomy into the peroneus longus, muscle belly, the hallucis longus, etc. He's got good strength with the hallucis longus. He's had a slight feeling of imbalance when he walks, and since this procedure, releasing this, and then here, as you can see, I did not do the full release down here. I just simply placed the implant next to the tibial nerve here. So the stem router is all we did there. I didn't do any redo here. He's already had a couple of operations there. So as far as your balance, what are you feeling now? As far as your pain level, what are you feeling here?
My pain level is down. I would say 30%. It seems like it's calmed
Okay.
the pain down.
Okay.
I not worn these long enough yesterday, and this morning my foot was burning like it normally was.
Okay.
But as soon as I put these on, it dropped.
Dropped it down.
Yeah.
So that takes the edge off kind of where you, that's good. The other thing, we compared the sensation on the outside top of your lower extremity on this to the other, and also the bottom, and you said that you have more sensation,
Yeah, definitely.
an increase in the sensation. Is there a way to put a value on that? 50% more or
I'd say 60 or 70% more.
60 or 70%?
And the feeling, yeah.
What you're feeling. So the pain's down, your sensation's up, and you said your balance seems to be a little.
Oh, yeah.
I noticed that.
You notice that? Yeah. So this is, I couldn't be happier with this, really. If you got just this amount right there, I'd be happy. That's enough for me as a doctor to say this thing's really helping you, and the procedure did. Hopefully it'll continue with this stimulus. And this is new to me, like in the last, well, it's been a year that we've been having experience, a year and a half, I guess now. So what our experience has been is that you keep doing this treatment, that you can notch this down and not have to treat quite as much, and the nerves just continue to improve over a year. So that's been
It's been a
standard.
miracle for us.
Don't hold me to it, but that's what we,
It's been
yeah.
over 20 years that he's had this affliction, so.
An affliction, that's a great word. Okay. All right. Well, I love to see the smiles, and I'm happy that you're doing better. Thank you for this, and my guys in this November, when I give our presentation, I think they'll love to hear this. Thank you.
Thank you.
All right.